A concussion is a functional brain injury as opposed to a structural brain injury. There's no bleeding or swelling in the brain when a concussion occurs that we can see on imaging. A person can get a concussion from a direct or indirect blow to the head or body. It causes the brain to shake inside the skull, causing the nerve cells to stretch and putting them in a metabolic crisis.
I fell at a ski race and I face planted and I had a black eye and I had a huge bump on the side of my head. I didn't get symptoms until the day after it happened, but I had a pounding headache and I couldn't stay in an area that was really bright. All I wanted to do was just put a towel over my head and just stay in the darkness and not open my eyes. When I was at the hospital, the doctor told me that I probably wasn't going to be able to remember things. My memory was going to be a little iffy, and I was and my schoolwork, it was hard keeping up with it, but all of my teachers were very understanding about it. So I didn't have to really worry about it because I couldn't really take any tests or anything and remember the information that was on it.
The long-term effects of a concussion can result in chronic headaches, depression, anxiety, mood disorders. They can result in chronic sleep disturbances and concentration and focusing difficulties most commonly. Younger athletes are at greater risk for long-term effects because their brains are still developing and it is a very sensitive time. The age of 12 seems to be an important trigger. If you suspect your child has a concussion, seek immediate help either from the emergency room, from your pediatrician, or from a concussion center or neurologist.
If you suspect a concussion, the child should always be evaluated in the ER, but especially if they're complaining of headache that's not relieved with Tylenol, nausea, vomiting, any photophobia or vision problems. If there's been a loss of consciousness, they should definitely be evaluated in the emergency department. And if there's any unusual dizziness and things like that. Typically, a patient would come in through triage, either by ambulance or walk-in. They would have their vital signs taken and they would give the reason why they were in the hospital, and we would observe them neurologically.
Through all the help with the trainers, once I stopped having headaches for a week, then I had to go to the trainer, and I had to gradually start exercising, and then if I got a headache while I was exercising, then I had to stop and wait another week. So they helped me make sure that I still didn't have my concussion, and I was healthy when I went back to playing lacrosse.
The program tests memory by flashing multiple words on the screen. At the end of the test, more words are shown. I had to remember which were among the original words. I also had to remember different shapes. The program also tests reaction time by flashing 2 shapes. I had to press the key that corresponded to that shape as quickly as possible.
There has to be significant, reliable change to occur on those post-injury test scores to say that that athlete has suffered some cognitive deficit after the concussion. Baseline testing is necessary in youth sports because it provides a baseline of information, as the test itself states. It lets us know that this is what the athlete is like before sustaining a concussion. It also protects the athlete from getting back into the sport before they have fully recovered.